Hi, I'm Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. This week, kind of looking at Dr. Mike's progress with his ankle and his knee, we're going to be talking to you about the exciting treatment options that we have at our clinic for dealing with patients that have acute injuries with their knee or chronic injuries due to arthritis. You'll want to stay tuned to see this. A lot of great information. Okay, first of all, how are things going with the treatment and progress?
Well, it's slow, but that's expected. So when you have a pretty good sized injury in a sense of the damage that took place from a fracture on the right ankle, but really the idea is that my recovery is by really working on my left leg, utilizing my supportive structure. Unfortunately, I sprained and injured this left knee, so it makes it a little bit slower to kind of get back.
You had a small fracture in that left knee too.
I did. So in my injury, I had a non-displaced fracture, so it was in position, so I didn't need a cast at all, but I should have been more non-weight bearing on the leg, but I had to utilize this leg to support my fractured ankle on the other side. So that needed treatment, and we went after it. We took care of that to help me get through that process sooner, and actually to speed it up a little bit because it is going to be a slow process.
Right. You know, you and I had a great conversation this week. We talked about, the things that we do here in our clinic. We're an integrated medical clinic where we combine medical care, chiropractic treatment, physical therapy, and we have a special interest and expertise in regenerative medicine. So those stem cells, those Wharton's jelly allograft injections to help repair, damage to the tissue, or those PRP, platelet-rich plasma injections that help add growth factor to help, your body heal itself. And we kind of use the term all the time that they're alternative treatments, but when we look at the way science is heading, isn't this turning more into mainstream medicine?
It really should be. The concept is that we often will see patients when they exhausted their treatments. Yeah. Oh, well, you did that, you got the therapy, you tried some medicines, and well, maybe go that because you're trying to look at the pain component. But if we think about the actual injury, the damage to the tissues, and actually from my fracture perspective, well, anytime you injure a joint, either a sprain or a fracture, it's going to be post-traumatically arthritic or degeneratively changed in time. Well, if we can make this more standard of care, get these regenerative injections on early, we may actually help promote healing sooner, like making your cut heal quicker and a nice scar tissue. That's going to actually reduce the chance of having arthritic changes or the degree of arthritis later. So we really want to think about this should be standard of care to say treat soon and treat early in the appropriate condition. We're trying to prevent arthritis, and that's a great reason why we think about injections sooner. If someone has arthritis, we're trying to inject to prevent progression of that arthritis. So we are looking at a way in which healthcare should be utilizing these treatments much sooner and much more standard.
Yeah, because the traditional model, and obviously your injury was a lot more severe, so that's not typical. If we're going to talk about like ankle injuries, we're talking usually about a sprain strain, or if we're talking about a knee injury, it's usually due to a flare because of arthritis, not the trauma. So you had to go obviously the traditional medical route, but too many times those patients that have those sprain strains, that have the flare up from the arthritis in the knee, they're automatically referred to the orthopedic surgeon. And it's at that point to where, it's almost an antiquated approach where they're utilizing more of the typical steroid or cortisone injections to decrease inflammation and pain, but adding more damage to the joint. Where in reality, it really should be the physiatrist, your area expertise, where the patient should come in, you do the thorough evaluation, and then we look at these cutting edge alternative treatments as a first choice to where you can actually heal the damage to the tissue. Isn't that right?
That's exactly right. And more commonly, depending if you see a primary care or go to the orthopedist, so most commonly we need to see resolution, and that usually is like, oh well, you need to work it, you need to rehab it, and that's what I'm going to be doing soon. So we send them to the physical therapist, and they're working on those, again, restructuring aspects of strengthening and things. But if you think about that, still it's delayed to get in, maybe a week or two. It takes 3, 4, 6 weeks to get through therapy. You're talking 2 months before you figure out, do I need another picture? Do I need imaging to suggest that maybe I missed something? Why is it not getting better? It would be nice to actually have that information up front, know right from the beginning, and then actually try to attack it from a treatment perspective early. And that's really the concept. We want to treat it and treat it appropriately rather than covering it. I certainly took some anti-inflammatories to start,
Sure.
but in relation to the swelling and the inflammation, we were able to get a regenerative injection.
Yep.
So that can help promote healing and not result in just reducing inflammation or covering pain, and actually prevent some of that destructive properties that cortisone might do. Here, if we get the inflammation down and we restore the healing properties sooner, we prevent disability, we prevent arthritis, or at least minimize it, and that's what we're really looking at. And then your PT has better effects. The effectiveness of restoring that strength and the range of motion is easier and a lot more effective.
Right, yeah, we have the opportunity to sit down with a patient, review their x-ray or their MRI, show them an example of a model of what their knee joint actually looks like. We have the ability to prescribe bracing if that needs to happen, and certainly in-house physical therapy and chiropractic treatment, and all of those innovative treatment options all under one roof.
Right.
So if you're suffering with knee pain, and if it's a chronic condition due to arthritis, you definitely want to give us a call so that you can schedule an appointment to see Dr. Marciello so we can do a thorough evaluation and talk to you about all of the exciting cutting-edge treatment options that we have here at our practice. Remember, folks, we take most insurances. Now Medicare is covering these Wharton's jelly allograft or stem cell injections. Well, that's it for today. We hope you learned something.